Have you ever wondered why a person, particularly an adult who develops shingles, may be asked or advised to run an HIV test? Don't get me wrong, if you recently developed shingles, that does not automatically mean that you have HIV, so don't be scared. However, in some situations, shingles can be the reason why a healthcare provider may advise you to get an HIV test done. Don't worry, there's a reason for it. Now, that reason is what I'm going to be explaining in today's video. So, if you're coming across my channel for the first time, you're welcome. My name is Uche Chichesendo, a clinical physiologist. Now, do well to subscribe and hit the notification bell so that anytime I post a new video, you build the first to see it. Now let's dive. Firstly, let's understand what shingles actually is. Shingles is also called herpes zoster, which is caused by Venezuela zoster virus, the same virus that causes chickenpox. But here is what happens. After someone might have developed chickenpox, chickenpox does not completely leave the body. It remains inactive inside the nerve tissues. Years later, the virus can be reactivated and cause shingles. Shingles typically causes a painful rash, often appearing as a blisters, particularly on one side of the body. Some people may experience itching sensation, burning sensation, tingling sensation, nerve pain. Now, so what does shingles have to do with HIV? I know some of you might be curious. Don't worry, I got you. You see, your immune system normally keeps this Venezuela zoster virus under control. Now, when the immune system is weakened, the virus may likely reactivate. We all know that HIV attacks your immune system, particularly your CD4 cells. As HIV progresses without treatment, your immune system becomes weakened, giving opportunity for certain infections to reactivate, and shingles is one of them. So shingles is one of the signs of weakened immune system. That is the reason why when you have shingles as an adult, particularly maybe if you have developed this chickenpox maybe as a child, because your immune system is supposed to create immunity for it already. So if it resurface as an adult, particularly as an adult, you might be advised to take an HIV test because that is a sign of a weakened immune system. Don't get me wrong, having shingles does not automatically mean that you have HIV. Take note of that. So why do healthcare providers recommend HIV tests when they notice their patient have shingles? You need to understand that shingles can occasionally occur in people that previously have undiagnosed HIV, especially when the shingles occurs at an unusual age and is severe and it keeps coming back after treatment. Then they might want to look deep into it. Now, who should consider HIV testing? Now, a HIV test is worth discussing with your healthcare provider if you notice the following. If you notice a rash or a blister, particularly one side of the body, and particularly if that rash or blisters is shingles at an unusual young age, or if you notice your shingles is severe and usually widespread, or maybe after you treat it, it comes back again repeatedly, or maybe you notice other symptoms or infection that may suggest that your immune system is not functioning normally. In this situation, testing can help identify HIV if it is present. Now, if you notice any of these signs, is worth getting an HIV test done. Now, you need to understand that many people with HIV may not notice any form of symptoms. Yes, you heard me. For years, they might go on live their normal life without obvious symptoms. That is why knowing your status is very, very important. If you notice any of these signs, don't just keep quiet. Now, you need to understand that HIV is not a death sentence. So why are you scared of knowing your status? You can go on and have your normal life, have kids, live a healthy life, provided you take your medication. So it's not a death sentence. That is why knowing your status is very, very important. Now, for those of you that are scared of testing, what exactly is your problem? You can make that decision today to go get tested. HIV only becomes a problem when you leave it untreated and it progresses to AIDS. That becomes a life-threatening condition. Don't allow it to get to that point. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.